What if I told you that your body already knows years in advance whether you're going to have a heart attack or a stroke? That there are silent signals, detectable with a simple test, screaming what neither you nor your doctor have wanted to hear? This isn't a magical prediction or an exaggeration. It's the most advanced science taking the side of your future. And the most shocking part, many people living today with devastating consequences could have avoided them, if only they had taken these tests in time. Today you're going to discover which tests could literally save your life. Because every year, millions of people over 50 suffer heart attacks or strokes without warning. But not because the body didn't warn them, but because no one knew how to listen. Stay until the end, because this isn't a medical talk. It's an alarm. And it might be yours. Let's start from the beginning. Why do some people who seem healthy, living a normal life, suddenly collapse from a heart attack or stroke? Because the heart and brain often don't give symptoms until it's too late. But the blood does speak. Your lab work can reveal a future you still have time to change. The first test on the list is one everyone should know but few take seriously: the full lipid panel. No, this isn't just about total cholesterol, that's no longer enough. You need to know your LDL, bad cholesterol, your HDL, good cholesterol, your triglycerides, and most importantly, your non-HDL cholesterol. That last one is strongly linked to cardiovascular risk, but few doctors mention it. If your LDL is high and your HDL is low, it means your blood is carrying a dangerous load of fat that can get deposited in your arteries. And this doesn't happen overnight. It begins slowly, silently, many years before the event. The second test is less known, but extremely powerful: the high-sensitivity C-reactive protein, hsCRP. What does it measure? The level of inflammation in your body. And here's the key fact: more than 50% of heart attacks happen in people with normal cholesterol levels, but with silent chronic inflammation. An elevated hsCRP means something inside your body is sparking an internal fire. That inflammation damages your arteries from the inside out, making them fragile, and at any moment, they can rupture, form a clot, and there it is, a heart attack or stroke. Did you know you can have inflammation without pain, fever, or any symptoms at all? That's what makes it so dangerous. The hsCRP test is your early warning radar. If it's above 1 mg per liter, there's already risk. If it's over 3 mg per liter, your chances of a cardiovascular event skyrocket. Another marker that can predict heart attacks up to 5 years in advance is your homocysteine level. This amino acid, when elevated, directly damages your blood vessel walls. Imagine your arteries developing tiny, invisible cracks. Those cracks become anchor points for cholesterol and clots. The result: atherosclerotic plaques that block blood flow to your heart or brain. Elevated homocysteine is linked not only to heart attacks and strokes, but also to cognitive decline and dementia. The worst part? Most people don't even know they should measure it. And the most surprising part? It's easily managed with vitamins B6, B12, and folic acid. But to fix it, you need to know it's a problem, and that only comes from a test. Let's move on to the HbA1c test, or glycated hemoglobin. You might think this is only for diabetics, but that's not true. This marker shows how your blood sugar has been behaving over the past 3 months. And here's the uncomfortable truth: many people are pre-diabetic without realizing it. And those slightly elevated blood sugar levels are already damaging arteries, increasing oxidative stress, and accelerating atherosclerosis. An HbA1c over 5.7% should already set off alarms. Now imagine combining several of these factors: high cholesterol, silent inflammation, elevated homocysteine, and unstable glucose. That's a ticking time bomb. It doesn't matter if you feel fine. Your body is already suffering invisible damage. But we're not done yet. There's another test, one that visually predicts whether your arteries are becoming blocked: the coronary calcium score. This isn't a blood test, it's a CT scan of the heart that measures how much calcium is deposited in your coronary arteries. And there's no guesswork here. If there's calcium, there are plaques. And if there are plaques, there is risk. It's that simple. This scan can predict your risk of a heart attack years in advance, even in people with no symptoms or family history. What's impressive is that it gives your doctor a clear image of what's happening inside without needing surgery or catheterization. And of course, there's one last factor that isn't talked about enough: your overall arterial health. A test called the ankle brachial index compares blood pressure in your ankle to that in your arm. If there's a significant difference, it means your arteries are stiff or blocked. It's an early sign of peripheral artery disease and also a silent predictor of heart attacks and strokes. Now that you know which tests can predict a heart attack or stroke up to 5 years in advance, let's go further. What does each result mean, and how can you turn those numbers into life-saving decisions? Let's begin with the complete lipid panel. If your LDL is over 130 mg per deciliter or your HDL is below 40 mg per deciliter, for men, or 50 mg per deciliter, for women, you already have a significant risk factor. But the most crucial value is non-HDL cholesterol. For people with moderate or high cardiovascular risk, this should be below 100 mg per deciliter, ideally under 80. This number reflects all the cholesterol that can harm you, and it's often more accurate than just LDL alone. What can you do if your levels are elevated? It's not just about medication. A diet rich in healthy fats, avocado, nuts, olive oil, soluble fiber, and regular physical activity can reduce cholesterol levels in just a few weeks. Now let's move on to the high-sensitivity C-reactive protein, HSCRP. If your results are between 1 and 3 mg per liter, that's moderate risk. Over 3 is high risk. What raises it? Chronic stress, an inflammatory diet, sugar, refined flours, trans fats, poor sleep, or even hidden infections. Lowering HSCRP requires a holistic approach: natural anti-inflammatories like turmeric, omega-3s, moderate exercise, and above all, eliminating what's keeping your body in a constant state of alarm. As for homocysteine, it should stay below 10 mol/L. When it goes higher, your vascular system enters the danger zone. The good news: with proper supplementation of vitamins B6, B12, and folic acid, you can reduce it significantly. But remember, this isn't magic. It's about monitoring, consistency, and re-evaluation. HbA1c, or glycated hemoglobin, is another cornerstone for early diagnosis. A value between 5.7% and 6.4% indicates prediabetes. Over 6.5%, diabetes. But even if you're borderline, silent damage is already underway. The good news: with a low-sugar diet, intermittent fasting, and building more muscle, yes, muscle helps regulate blood sugar, you can reverse the process completely. I've seen patients lower their HbA1c from 6.1% to 5.4% in 3 months without medication, just by changing their diet and movement routine. And what about the coronary calcium score? This is one of the most underestimated and powerful tests. It's a non-contrast CT scan that gives you a number. If it's 0, excellent, near 0 risk. Between 1 and 100, mild risk. Over 100, immediate action needed. Above 400, you already have significant coronary disease. This result is not subjective. It doesn't depend on your age, sex, or appearance. It's the truth in images. And often, a truth that saves lives. We also have the ankle brachial index, ABI. A value between 1.0 and 1.4 is considered normal. Below 0.9 indicates peripheral artery disease. Above 1.4 suggests arterial stiffness. Both ends of the spectrum show that your arteries are not healthy. This test is simple, painless, quick, and affordable. And yet, most people have never even heard of it. So, what do you do with all this information? First, ask for the tests. Bring this list to your doctor. Demand your health like you would demand a warranty on a new car. Your body is your most valuable vehicle. Second, build your personal risk map. Combine the results. Moderate cholesterol plus high HSCRP plus elevated homocysteine might be more dangerous than just high cholesterol alone. Don't look at each test in isolation, look at the pattern. Third, act before it's too late. The human body has an incredible ability to repair itself. Even if you already have plaques, you can stabilize them, reduce inflammation, strengthen your arteries, and prevent rupture. That's the difference between living and just surviving. Fourth, don't wait. Heart attacks don't give warning. Strokes don't wait, but you can anticipate them. Let me tell you a real case. Marta, 63 years old. No symptoms. She only decided to take these tests because her sister had suffered a heart attack. Her hsCRP was 4.2 mg per liter, homocysteine at 14, and coronary calcium score, 280. She had never taken a single pill. Today, 1 year later, with dietary changes, proper supplements, and daily exercise, her hsCRP is down to 1.3, homocysteine down to 9, and calcium stable. No invasive procedures. Just information and a decision. Remember this, it's not about living in fear. It's about living with awareness. There's no better prevention than knowledge. And now, you know what most people still ignore. Get the tests. Evaluate your risk. Act before it becomes an emergency. Because a heart attack isn't lightning from the sky. It's a storm that's been building. And you still have time to open the umbrella. And if this video helped you, leave a comment below. Had you heard about any of these tests before? Have you taken them? Share this information, it might save a life. Maybe your own. Or someone you love. Subscribe for more vital content. And never forget, longevity isn't luck. It's strategy.